Thanks a lot, Anna Kennedy and the scientific committee to invite me to this lecture. I have great memories to the CLF in Montreal in 2018, where I had the pleasure to speak about obesity-related lymphedema. Now, my topic today is a little bit more delicate. Today, I'm speaking about lipedema. And those of you who know a little bit about this field will probably heard about the debates within the lipedema community. Of course, that discussion also will be part of my lecture. I will try my best to clarify what lipedema is and moreover, what lipedema is not. I divided my presentation in 3 acts. Act 1, why we needed this paradigm shift. Now, there are still a few colleagues, mostly from the United States, who still believe in the traditional view of lipedema, believe that lipedema is an edema disease, and as a consequence, they recommend MLD for patients with lymphedema. According to these colleagues, fluid edema should be responsible for the pain experienced by lipedema patients. But if these statements are true, if there's really edema in lipedema, edema which is responsible for the pain of our patients, how do you explain why patients with lymphedema of the legs, like these patients, or of the abdominal wall plus scrotum, who both have really a lot of fluid in their tissue, why do these patients usually have no pain? Or patients with venous edema or cardiac edema, why do these patients have no pain? If edema really would be the cause of our patients' pain, these patients must be under treatment with morphine, and we all know this is not the case. And furthermore, in general, ladies and gentlemen, what fluid, what edema, what role does the edema actually play in this disease, lipedema? Now, this question is essential because this non-existent fluid is the reason the patients demand and get MLD, at least in Germany and other European countries. Indeed, there is no serious scientific evidence for this fluid, but let's go a bit deeper. Now, edema are by definition fluid accumulation. This is a lymphedema, not a lipedema leg, and you can see fluid by pitting edema or by high resolution ultrasonography of the soft tissue here, the dark spots. This is the fluid. And I see far more than 1,000 lipedema patients every year, but I must assert none of my pure lipedema patients present significant edema. Now, by means of the ultrasound, we can see the fluid here in the patient with the lymphedema, but there's no fluid in the area where patients suffer from lipedema, where the patients suffer from pain. Now, a few American colleagues wrote to me, this fluid, the lipedema, is not visible by ultrasound. Okay, then let's have a look to other visual techniques. What about MRI, lymph angiography, which has a high sensitivity regarding fluid? Now, this is a study by Selina from Italy, and with a group, she investigated lipedema patients, and she concluded the fat tissue was homogeneous without any signs of edema in pure lipedema patients. And quite often, also particularly from a few colleagues from the United States, you will hear that lipedema is a lymphatic problem which could lead to lymphedema. And you will hear that a biomarker for lipedema has been discovered. In fact, there's no scientific evidence for this claim. To emphasize this point, at the Foley Clinic, we see daily patients like these who suffer from 3 diseases, from obesity, which is a disease and not a matter of fault, from lipedema here of the thigh and the upper part of the lower leg, and lymphedema here with a mild stasis dermatitis. But the lymphedema is not caused by lipedema, which is often claimed but by the obesity. This is the obesity-associated lymphedema. And we know very well the pathophysiology for this development. And of course, a biomarker for lymphatic insufficiency will be high in these patients. Now, of course, there are patients who suffer from only 2 diseases, from obesity plus lipedema. And the question for clinician is not lipedema or obesity. The huge majority of patients suffer from both diseases, from lipedema plus obesity, and we have strong evidence that approx 85% of the patients with lipedema are obese, and 50% of our lipedema patients are morbidly obese, which means they have a BMI more than 40. And when you treat the disease obesity, for instance, by bariatric surgery, you also will treat the lipedema. This is a patient who is now free of complaints at the Förde clinic. We call this lipedema in remission. And we see now everyday patients who experience a remarkable amount of weight loss after bariatric surgery, a remarkable amount of volume reduction in the legs, and of course, a remarkable improvement of their lipedema. Now, to evaluate our clinical experience, together with the University of Freiburg, we conducted a study about the impact of bariatric surgery on the volume of the thigh of patients with lipedema. And please note, many self-proclaimed experts will tell you that weight loss has no impact on the lipedema. In fact, the opposite is true. As you can see here, the volume of the thigh at the y-axis and the time after surgery, the first and the second year after at the x-axis. And patients with lipedema lost the same amount of volume in the thigh as the control group, even a bit more. And to visualize this, have a look at the picture of the right side. This was a patient 10 months later. She was free of any complaints. So, to contrary to the US view that lipedema is a lymphatic disease, is also the study of Epa Gespopoulos from the University of Zurich. Epa examined tissue of patients with lipedema with molecular pathological methods. And his conclusion, you can see here, no morphological changes in the lymphatic component are present in lipedema. Contrary to the US views, also the international study by Fellmauer et al. From the University of Göttingen, histological evaluation of the lymphatic vessels using 3 distinct lymphatic markers. What is what you can see here, the 3 distinct lymphatic markers revealed no change in number, size, and percent coverage of the lipedema group and the control group. Their conclusion: no apparent lymphatic anomaly underlies lipedema. And now this sentence is really essential, providing evidence for the different disease nature in comparison to lymphedema. So please note, lipedema and lymphedema are completely different diseases. Of course, in some cases they can occur simultaneously, like you see patients with diabetes, or at the same time they suffer from hypertension. But you will agree these are completely different diseases. So please forget the term lipolymphedema. Lipolymphedema suggests that lipedema leads to lymphedema, that lipedema can be the cause of lymphedema. But please note, we do not have any scientific evidence for these popular statements. For this reason, forget this term at the Förde clinic. We never used this term for years. And contrary to the US view, is also this great study from René Hegerling from the Charité in Berlin. Ronnie won several science prizes for developing the Viper method. Viper is a great imaging technique to visualize tissue structures in a 3-dimensional presentation. And he concluded no characteristic changes of the lymphatics in lipedema compared to the control group. And I would like to give you an example of Viper. Here, the control group, no lymphedema, no lipedema, healthy patients and healthy lymphatics, of course. And this is a patient with lymphedema stage 2. You see the disrupted, the non-connected lymphatic fragments, the congestion in the lymphatics, the chaotic organization. And here, a patient with lipedema, very healthy, beautiful lymphatics. Now, after all this consistent evidence, who among you believe that lipedema is an edema disease? Who among you still believes that lipedema is a lymphatic disease, a disease which leads to lymphedema? And who among you still believes that lipedema should be treated by decongestion, should be treated by MLD? Now, I would like to respond with a statement of former ISL President Sandro Michelini from Italy.
It's not possible to drain cells. No manual lymphatic drainage is very low. The clinical effect is a placebo effect, the manual lymphatic drainage in this subject.
Now, I would, you should know now, there is no edema and lipedema. Therefore, we think lipedema, and ladies and gentlemen, that is the reason why we needed this paradigm shift. Act 2. Now, this paradigm shift in lipedema is first and foremost a perspective change away from that what lymphologists believed to see in the last decades, which is an edema in lipedema, an edema which needs decongestion. towards an appreciation of the real complaints, the real suffering of our patients. And only if we are able to change our perspective, only if we are able to see the real complaints, the real misery of our patients, only then will we be able to provide a treatment concept which is also successful in the long term. And now, what are the real complaints of our patients? At the first glance, fat legs and pain, and these are the major criteria according to the International Consensus document. And as mentioned at the first glance, but I think indeed, and I guess everyone who treat patients with lipedema will confirm that their complaints are much more complex. And already mentioned, around 85% are obese, and they suffer from their obesity. They suffer from a poor fitness. According to our data published a few months ago, more than 75% of our patients present a poor and under-average fitness level. According to our study at the Furley Clinic, lipedema and pain, what's the role of the psyche? 80% display mental stress and disorder. But please note, this mental stress disorder already existed before the lipedema complaint started. So purely in terms of pharmacologic, something that temporarily precedes the development of lipedema cannot be its consequence. In other words, usually it's not lipedema which leads to mental issues of our patients. In fact, the opposite is true: obesity stigmatization, previously existing psychological issues, and social pressure on account of our current beauty ideal contributes to an essential amount to this disease we call lipedema. And let me give you an idea with this picture here. This bowl represents the diagnosis of lipedema. Imagine the diagnosis of lipedema as a pot, the kind of melting pot for all these different problem areas. And the lipedema offers a reasonable explanation for all these. Quite often these are tragedies in the life of our patients. And of course, our patients suffer from pain in the soft tissue, and we should treat this pain. But the pain perception is strongly dependent on the psychological, on the mental situation of our patients. Moreover, more than 80% suffer from weight gain and are obese, and suffer from a poor fitness, as mentioned, and suffer from, when they're obese, they suffer from they are stigmatized because of their obesity and of their big legs, in fact, rightly, and not at least by medical doctors. And finally, many patients suffer from a lack of self-acceptance because of the current beauty ideal. Now, beside all, one thing is clear: edema or lymphatic insufficiency is definitely not the cause of the complaints of our patients. Now, in 2018 and 19, I invited lipedema experts from several European countries, from several professionals like physiotherapists, specialized nurses, medical doctors, obesity experts, psychologists, and surgeons to come together in Hamburg, in Germany. And all attendees are renowned experts in these fields, like Christine Muffet, Christiana Gordon, Robert Damstra, many others. In the meantime, also other well-known experts are part of this group, like Hakan Rosen from Sweden, Miguel Amore from Argentina, or Neil Pillar from Australia. And let me emphasize that I feel privileged to work with these outstanding colleagues in this project. And with the focus on the real complaints of our patients, a consensus document has been worked out, and it was published in last year in 2020 in the Journal of Wound Care. And many experts from several countries support and spread this consensus document. And I'm very happy and feel honored that Professor Hugo Bertsch, the world leading phlebotomist, many call him the compression pope, agreed to write the foreword of this international consensus document. And I quote from this, from his foreword, he wrote, "Lipedema neither includes edema, nor is there any scientific evidence for lymphatic insufficiency." Professor Hugo Bertsch. Act 3, what should change over the next few years? Now, first and foremost, we should stop disinformation, half-truths, and misinformation around this disease we call lipedema. We should distinguish between fact and fake, between science-based information and misinformation. Or to say it in the words of Joe Biden during a debate about lipedema at the US Congress.
We need some straight talk right now, because there's a lot of fear and misinformation in the country. We need to cut through it with facts, with science, with the truth.
And secondly, our therapeutic concept has to change. We need a treatment which focuses on the real complaints of our patients, which is not edema, but which are these. Now, this is the therapeutic concept which was worked out by the consensus group. And let me emphasize that movement therapy and conversion therapy plays a key role in this concept. You can find a detailed explanation of all the therapy pillars in the International Consensus document. Now, let me finish Act 3 with a personal question which I can't get out of my head. I know our patients with lipedema suffer from pain in the soft tissue of the legs, sometimes of the arms. But do you really think we would be talking about lipedema today if the current ideal of beauty would not be this, but would be this? Now, many plays have an epilogue, my lecture too, and in this epilogue, let me say that I'm aware there are a few who still believe in the old law of lipedema. I'm aware there are a few who insist to walk on the old way. But those folks should know old ways won't open new doors, particularly when these old ways are far away from science, when these old ways are far away from the real suffering, from the real misery of our patients. But let me emphasize, much has already changed. For example, the German lipedema guidelines have been reformed currently, and several German members of the International Lipedema Forum are part of this guideline commission. Moreover, the International Consensus document was published in October 2020 in the British Journal of Wound Care, and as mentioned, high-ranking experts from 15 European countries, as well as from colleagues from the United States, Australia, Canada, and Australia and South America, support and spread the consensus document. Moreover, the paradigm shift and the international consensus document has been widespread at many national, like this one in Canada, but also international conferences. For instance, the ILSN conference last in Athens in September. 1 week ago, we had the ILF in Copenhagen. There was also the paradigm shift, a huge topic. And also at the ELA conference in May, next May, the paradigm shift in lipedema will be a big issue. Moreover, at the 3rd International Lipedema Forum, which took place in Copenhagen, we have founded the International Lipedema Association, the first association to this disease, which only consists of health professionals. And more than 50 founding members from 15 European countries, as well as around the world, have launched this international society. And all these are renowned experts in these fields. And since this lecture had to be recorded already 3 weeks ago, I cannot show you the updated picture of this founding group. And moreover, and last but not least, and I have to admit, this fact makes me really, really happy. At the Förderle Clinic, which is the European Center of Lymphology in Germany, we already treat our patients with lipedema strictly according to the International Consensus document, and our first results are very promising, what you can see at this picture. Now let me finish this talk with the new credo of the Förderle Clinic. This is what we believe as a result of our first experiences with this new concept. We say at the Förderle Clinic, we don't only treat our patients with lipedema, we make a difference in their lives. Thank you very much.